Hello friends, in this video we are going to learn about what is retained placenta. First we will see the definition of retained placenta. Placenta is said to be retained when it is not getting expelled out of the uterus after 30 minutes of delivery of baby. Usually once the baby is being delivered, that is in the second stage of labor, the baby gets delivered, and the third stage is where the placenta has to get expelled out of the uterus. But here what happens in retained placenta is the placenta gets retained into the uterus even after the 30 minutes of delivery of baby, and this condition is called as retained placenta. The causes of retained placenta is mainly because of failure of the woman to push the placenta because of exhaustion caused by prolonged labor, or it may be because of the closure of the cervix, preventing the placenta from being expelled out, or a constriction ring which is in the uterus helps have the placenta inside the uterus. So these are the causes of the placenta for not getting expelled out, followed by the delivery of the baby. So before moving into the further explanation, we'll see first how normally the placenta is expelled out. Usually the placenta is expelled out in 3 stages. First, it should get separated from the uterine muscles, and then it has to descend down into the uterine segment. First, it should separate from the uterine muscles, then it should descend down to the lower segment of the uterus, and finally it should get expelled out of the uterus. But what happens in retained placenta is that any problems associated with these things can result in the retained placenta. So as I already told you, the placenta has to get separated from the uterine wall before it is getting expelled out of the uterus. Any problem with the detachment of the placenta from the uterine wall can result in the retention of the placenta inside the uterus. So it can occur with a condition called as a simple adherent placenta. As we see here, what happens is the placenta fails to separate completely from the uterine muscles, mainly because of the uterine atonicity. It is a condition in which the uterine muscles becomes relaxed, especially when the mother gets exhausted, or it may be because of repeated pregnancies or prolonged labor or over distension of the uterus, as we see in case of twin pregnancies. So these are the conditions which makes the placenta for not getting detached itself from the uterine muscles, especially because of lack of the contractions of the muscles of the uterus. After simple adhesion of placenta, we see a next condition called as morbid adhesion placenta, which mainly occurs when the placenta fails to get separated from the muscles, mainly because the placenta is deeply implanted into the uterine muscles. So resulting in the removal of the uterus, that is hysterectomy procedure has to be done in these cases. Placenta becomes a morbid adherent placenta mainly in these 3 types. So morbid adherent placenta can occur in these 3 morbid conditions. One is a placenta accreta, in which the placenta penetrates deep into the uterine endometrium. But one thing, it will not penetrate into the muscles in case of placenta accreta. And placenta increta is a condition in which the placenta attaches deeper into the uterine wall, and also it penetrates deep into the uterine muscles. And the third morbid condition is a placenta percreta, in which the placenta not only penetrates to the full thickness of the uterine muscles, but it also attaches to another organ such as bladder or rectum. So these are the 3 morbid conditions which can cause the lack of detachment of the placenta from the uterine muscles, mainly because the placenta is deeply attached or burrowed into the uterine muscles. Next, we are going to see certain risk factors which puts the woman at the risk of getting this retained placenta. One is premature labor, the other one is labor induction. Okay, and then a lobulated placenta is a condition where the lobules is there in the placenta, and you can see the woman has already suffered previously from the retained placenta, and the woman after 35 years becoming pregnant, and in that cases, and also in case of stillbirth and the woman getting exhausted in a prolonged labor. So these are the risk factors which puts the mother at risk of developing retained placenta. The management of the retained placenta is usually done by controlled card traction. Now we'll see what is controlled card traction. So in controlled card traction, we are going to hold the clamped card in one hand and place another hand in the woman's pubic bone, and when the mother gets the contraction, try to put a gentle traction over the umbilical cord and gently remove the placenta entirely. So this is the image which is showing you the controlled contraction, where one hand is held on the woman's pubic bone and the other hand is hold on the umbilical cord, and but the umbilical cord should be secured with some hemostatic forceps in order to control the bleeding. And when you see the contractions occurring, we should gently pull the cord so that the placenta is detached entirely from the placenta and removed out completely. So this is contraction. Or we can also go for manual removal of placenta. So manual removal of placenta is done where we are trying to attempt to remove the retained placenta after the childbirth, and this one manual removal of placenta will be discussing in detail in the forthcoming videos. Please do keep following my videos for the further updates. Okay, so friends, in this session we have seen about what is retained placenta, what are the causes of retained placenta, and what is the management, and what are the risk factors. Thank you for your listening, and if you like this video, please do comment, share and subscribe to my channel. Thank you.